Hello everyone, welcome to my channel, and now we will talk about GV Black's classification of dental caries. But first, who is the GV Black? Green Vardiman Black died in 1915, is a dentist in United States. He is the father of operative dentistry. He standardized cavity preparation, cutting, and filling instruments. Dental caries, commonly known as tooth decay or cavities, are classified into 6 main classes based on the location and extent of the decay. Class 1, pits and fissures. Class 2, posterior proximal or margin. Class 3, anterior proximal. Class 4, anterior proximal incisal edge. Class 5, cervical, gingival, buccal, and lingual. Class 6, smooth surface. Class 1, pits and fissures. This is the most common cavity, found in the occlusal surfaces of molars and premolars, also found in the buccal and lingual pits of molars and the lingual pits of maxillary incisors. Class 1 caries occur in the natural grooves and depression on the chewing surfaces of the teeth. These areas are prone to decay because they can trap food and plaque, making them difficult to clean thoroughly. Class 2, posterior proximal or margin, found on the proximal, mesial or distal surfaces of premolars and molars, which are the sides of the teeth that touch adjacent teeth. Class 2 caries occur on the surfaces between the teeth where they are difficult to clean with regular brushing. Class 3, anterior proximal, found on the proximal surfaces of anterior, front teeth, including incisors and canines. Class 3 caries affect the sides of the front teeth but do not involve the incisal edge or the biting surfaces. These cavities are usually visible and can affect the appearance and function of the front teeth. Class 4, anterior proximal incisal edge, found on the proximal surfaces of anterior teeth and extend to the incisal edge. Class 4 caries are more extensive than Class 3, affecting not only the sides of the teeth but also the biting edge. Class 5, cervical, gingival, buccal, and lingual, found on the cervical or neck region of the tooth near the gum line on the buccal or cheek and lingual or tongue surfaces. Class 5 caries occur in the area where the tooth meets the gum and are often caused by poor oral hygiene leading to plaque accumulation. These cavities are more prone to occur in patients with receding gums or dry mouth conditions. Class 6, smooth surfaces. This is the rarest cavity. This can be found on the smooth surfaces of the teeth, typically involving the incisal edges of anterior teeth or the cusps of posterior teeth. Class 6 caries are less common and usually result from wear or development defects rather than typical decay. These cavities are located on the flat surfaces where there is less likelihood of food trapping. Just a recap: dental caries, Class 1, pits and fissures, Class 2, posterior proximal or margin, Class 3, anterior proximal, Class 4, anterior proximal with incisal edge, Class 5, cervical, gingival, buccal, and lingual. Class 6, smooth surfaces. That's all. Thank you for watching. I hope you learned something.